Hello class, my name is Belinda Cavazos. This is a literature review for our class, The Aging Process with Wound Care. I believe if there were better experience in the wound care process, it could reduce stays in hospitals or long-term care facilities and reduce the cost of care in relation to those wounds, especially bed sores, also known as pressure sores. People in lower socioeconomic status suffer the most. The prevention and maintenance for wounds is essential to better quality of life during the aging process. Pressure ulcers are not infections, but constant repetitive pressure on one area of the body. It usually occurs on people over the age of 65 who become frail and immobile. People with diabetes or other issues which prevent blood circulation of an individual are at risk. For example, like a water hose being bent to cut off the flow, the blood flow that is. People living with dementia may not have the ability to describe their pain, which may lack treatment. Most occurrences are above the sacrum and heel due to friction and shear of body movements. For example, a person sliding down from bed or wheelchair-bound person from constant sitting and may lack sensation in their sacrum area, resulting in deep tissue injury from continuous rubbing. Also, those who are incontinent, the moisture from leaky wounds along with the urine and bowel movements can affect the skin with decrease of protective oils. There are 4 stages of pressure sores. Stage 1, mild on the upper layer of the skin, may appear red in color, painful to the touch, warm temperature from surrounding normal tissue. So it's best to remove the pressure from that area of the body. Healing can be done up to 3 days. Stage 2, in addition to the previous description, an open serum-filled clear to liquid fluid blisters up with a drainage or pus at the ulcer. Worsening pain is felt by the person. Swollen or red tissue may indicate dead tissue or damaged tissue. It takes 3 days to 3 weeks to heal in this process. Then there's stage 3, as you see in the picture. Broken skin into the fatty tissue. It resembles a type of a hole or a crater. An infection may be present. There's a foul odor, pus, redness, and discolored drainage. Immediate attention is needed. It may take 1 to 4 months to heal at this stage. And then stage 4, which is the most serious, high-risk stage. It extends into the deep tissue, which includes muscle, tendons, and ligaments. Extreme cases can extend to cartilage or bone. There's extreme pain at this stage. There's lots of drainage. Dead tissue may appear black. Visible muscles and bone may appear. There's a foul smell and pus. Hardened dark substance area called eschar, which is E-S-C-H-A-R. Dead wound tissue is the meaning. It may take 3 months to 2 years for healing. When this stage is present, a person must be hospitalized immediately and may require surgery. Assessments should be made frequently to the person at risk. Better support to the body, like air mattresses, should be used that help control heat, moisture, and prevents shearing of the body. Cushions placed under the person's body is very helpful. Heel protectors are necessary. Foam wedges near the lumbar, ankles, and knees. Foam cushions for wheelchair-bound people, because these can help prevent or cause further damage to the skin. Skin care is also important. Turning the person at least every 2 hours is very helpful. Avoid excessive removal of the bandages, for this can prevent removal of healthy skin. Avoid skin irritants to the wound. Keep the wound area dry and monitor on a regular basis. Nutrition is also very important when a person is at risk. A nutrition team should regulate the person's diet. Lack of nutrition, especially people living with dementia, who may not only struggle to feed oneself, but may experience difficulty swallowing. So protein is necessary for connective tissue and source of energy. When this is lacking in the diet, there is a tendency for poor wound healing. Maintaining blood sugar, especially for those people with diabetes. People with uncontrollable diabetes have a tendency to develop foot ulcers. So people with lower cognition or education don't always understand the necessary precautions in lowering sugar levels. This may cause a delay in getting treatment to the wound. And when a person is released to the home, it is necessary to provide the family caregiver or home health person give them the necessary awareness for the wound care. Family members may have fear of making a mistake, so a nurse should provide clear written and verbal instructions for wound dressing, necessary supplies, or medications for the person. And the family members should watch the nurse demonstrate the wound care process prior to discharge. The person should also check for any signs of infection. If so, they should seek medical attention immediately. Also follow up with their assigned doctor for proper wound assessments on a regular basis. There was a study conducted from 2003 to 2008 which indicated a higher rate of pressure ulcers found in older Black men with diabetes and stroke, while on the other hand, the white older men had a higher rate of dementia and musculoskeletal diseases, but a lower rate of pressure ulcers. In 2003, another study was conducted and indicated people at high risk for pressure ulcers were Black older men older than 75 years old with an income lower than $35,999 a year. The reasons were found that many of these older Black men were in Medicaid facilities with high turnover rate of staff and limited resources to give wound care to these certain residents. And here's a tidbit. During my internship, I had the opportunity to work at 2 different skilled nursing facilities in the Austin area. It was Dripping Springs, which is just southwest of Austin, and Westlake Hills, which is just west of Austin. They both had Caucasian as a majority of the residents. However, Dripping Springs was more of a mom and pop type of community. There were farmers, teachers, that type of economic status, and it was a Medicaid facility, a high staff turnover rate, no wound care team, wounds developed during the stay, and those people were transferred to other facilities that could provide the care that they needed. On the other hand, the Westlake Hills, they were very wealthy residents. They used to be lawyers or CEOs, that type of socioeconomic status. It was a non-Medicaid facility. The staff were very loyal. Many of them were there more than 10 years. And they constructed of a wound care team, and the wounds healed and or were prevented due to assessments done on a regular basis. I believe wound care relates to human agency. Within the constraints of the world, people are planful and make choices among options that construct their life course, as cited by Elder in an article we had in class. Better wound care could help develop health, social awareness, and other policies for older individuals. People should have the autonomy in life through dignity and respect for aging and the right to receive better end-of-life care. 2.5 million pressure ulcers are treated yearly. The cost of wound care due to pressure ulcers have been estimated between $5 billion and $8.5 billion on an annual basis. Those who acquired a pressure ulcer during the stay in acute settings were between $2.2 billion and $3.6 billion of those estimates. I feel that there should be better treatment programs and policies through reimbursement in Medicare and Medicaid. Medical providers should not have to decide whether or not to use resources that are necessary based on the reimbursement rates from the insurance companies. I believe more research is needed for older people with darker skin tones and people living with dementia because it was found too late for treatments and preventative measures if detected sooner. Thank you for your time.